Thank you, sir. You're an excellent communicator and a humble man, and I know you'll have no trouble with these questions. In the order that they're presented anonymously, the questions are as follows. Number one, are posterior tongue ties actually real?
Yes, it is.
Okay.
Like they're real. We have an anterior tongue tie and posterior tongue tie that is actually attached deep down to the genioglossus. And that is why sometimes you see people call it tongue release for a posterior, anterior tongue tie. But for the posterior tongue tie, sometimes you need to do lingual pharinoplasty.
You want to speak a bit about that? Who does it and how
Uh, like some I have Dr. Paul Batty, who is in, like I think McMaster, who does that, but I don't know anybody else who does the lingual pharinoplasty in my area.
Okay, thank you. Next question. Is excess folic acid a possible cause for ankylosing?
It is some research, yes, they are relating that to, but to be honest, I have no uh, any knowledge about that.
Okay, thank you. Next question. I had a Spanish mom who was distraught that her child could roll his R's. Within a week of tongue tie release, he could roll his eyes. Mom was so happy. Couldn't
Yeah,
roll his eyes until the procedure. Comments, please.
yeah. The R's, is because also the you need to understand that the R sound, it comes in a different forms. Like a light R, a dark R, like a trill R, and like it comes in a different form. And I think the Spanish R and the French R is a little bit difficult. Without a tongue tie release, would be very difficult to do the R sound. Like it comes like either a yeah, like yet for red, or let for red. So you substitute the R sound with the yeah sound or an L sound. So when you do the release, because you need to go up and have that, like drill, or like and trill under your, with the on the uh, just behind your upper teeth, the incisors. So if you cannot lift your tongue, you cannot do the R.
Okay, good. Now, do you do the releases yourself or do you refer that out?
No, I don't. I'm not a doctor. I don't do it. I just send them to Dr. Gordon Weir, or like Dr. Paul, and sometimes it depends on the location, because they have two offices, one in downtown Danforth, and one in the main one is in Mississauga. So
Okay,
it depends on who.
thank you. Perhaps in the oral questions, we'll get other people chiming in. Next question. Do you treat both symptomatic and asymptomatic tongue ties?
Yes, like I try, and work with them, because sometimes, as I said, is more psychological, and even when you do the tongue release, they still continue to have that, like a gag reflex. So they do need some counseling,
Okay.
and then gradually they can, like they can do it. So yes, I do. Like do I succeed with, successful with all of them? No, I'm not.
All right. Next question. I had an acquaintance who eliminated his gag reflex by tying a washer to floss and forcing a gag reflex numerous times a day. He then became a sword swallower. I don't think I want to know more about that, but he's had a walk with the floss. So can you help us with that one?
Yeah, I really don't know, but I think human beings can do a lot of things. If they're determined, like they can do it. Yeah.
Okay. So this is a general question. Has anyone had success in helping a patient reduce their gag reflex non-surgically or surgically? Reducing gag reflex surgically or non-surgically? Can you comment on that one?
For me, or this is for everybody?
Well, no, how about you give us your feedback on that?
Like with a tongue tie release, yes, but without, like, like surgically, I don't think like is we are able to, like to reduce it, because most of the time we are not talking about gag reflex. I'm talking about hypersensitive gag reflex.
Okay. Next question. Can the hypersensitive gag reflex be a result of untreated sleep apnea?
It could be, could be, like some, like if the tongue, is always resting on the uh, floor of the mouth, and then you have that is, like Bianca, I can
Yes.
kind of share something here. I don't know if
Uh,
anybody's.
It
Yep.
should be able to. There you go.
Yes, here I am. Okay, so if we think this is, like your pharyngeal wall, when you swallow, all the time your tongue should make contact down here at the pharyngeal wall. When you have a tongue tie and you always have, we call that base tongue retraction. So when you have a tongue tie and you become a tongue thruster, your tongue is always going forward. You do have that, like a retraction, but it will become very weak, like gradually become weaker and weaker and weaker, because your tongue is always forward. So when you sleep, then your tongue, that we call that the, like the proximity between the pharyngeal wall and the base of the tongue become so big. And I think that when they start having that sleep apnea issue, that is just my theory.
Okay. Thank you. Next question. Can a hypersensitive gag reflex be a result? Oh, sorry. I just did that one. Is the correlation of smoking and hyperactive gag reflex direct and indirectly related?
I'm sorry, can I?
Is the correlation of smoking and hyperactive gag reflex direct and indirectly related?
It is actually, it is the opposite.
Okay.
The smoking could, like if you are just have gag reflex, if you are a heavy smoker, that might diminish your gag reflex, not the other way around.
Okay. Good. Thank you. Hey,
Hello.
Ryan.
Back.
Welcome back, my friend.
Thank you. This is a fascinating topic. I do frenectomies on a fairly regular basis, so it's this is pretty fascinating. I really enjoyed your lecture. Thank you for sharing this. This was
Thank
really
you.
good.
Can you tell us how you do the frenectomies?
So I've used the diode laser and the scissors. I find I like the scissors more. I've sort of gone more to the scissors over time and put aside the diode laser more and more. And that kind of relates to my question, actually, for our speaker. Mohamed, do you have a preference, or have you noticed a difference between the way that the frenectomy is done, whether it's a iridium laser or a CO2 laser versus scissors or any other surgical means? And I guess as a secondary to that, If it is sort of more of a blade, normally I would do sutures under the tongue. Just wondering what your experience you've seen in. I know you don't do them, but perhaps you've seen it, and just want to share some of your experiences from your colleagues that you've dealt with. Thank you.
Thank you. I prefer the scissors all the time. And I don't know why, but I think I know why. Like I have seen the difference when they do the scissors. It is not easy to reattach, and it is always done a little bit deeply. Like they go deep to, like to the base of the tongue, and they do a better job with the scissor. This is my experience. And also, but I don't suggest to my patient or the doctors what to do. But from my side, I have different exercises. So if they are doing laser, then they have post like surgery exercises that is different from if they are doing like a scissor surgery. Yeah,
Okay, that's interesting. Okay,
yeah,
what would be the difference between the exercises?
the stretch.
There'd be more stretching with the laser? Is that
Yes, more stretching with the laser,
okay?
less stretching with the scissors.
Okay, okay.
Yeah, I have different. If you send me your emails, and if you want me to send you the exercises, the different exercises and how I do them, I would be more than happy to share that with you.
That'd be wonderful. Thank you. Yeah,
And
sounds great.
Thank you, Dr. Cormack. I'm glad to hear that you're working with colleagues in your area. I'm glad to hear that you're spreading the knowledge and helping our patients, because while we work in a fairly segmented medical dental world, it's a holistic approach that we all should be encouraged to follow. And it's very hard for some of us who've been around for a while. So thank you, sir, for your help. We hope you enjoy a good, restful summer, everyone.